Hi, we just wanted to do a short webinar just to introduce you to the Student Nurse Associate Apprenticeship that used to be the TNA apprenticeship and the Registered Nurse Degree apprenticeships that you can do in general practice in the BNSSG area. We are legacy nurses. I'm Helen Russell and
I'm Jenny Bowen.
And we are leading on the apprenticeship programmes for the registration. So the entry criteria for the Student Nurse Associate is that they must have, and for the RNDAs, they must have evidence of English and Maths grade 4 to 9 at GCSE or a Functional Skills Level 2 certificate in English and Maths. They must hold a Level 3 qualification or BTECs or A-levels in any subject, not necessarily healthcare. There are some exemptions to this, and I know Western College will accept students without a Level 3 qualification, and they will just have to write an essay and have an interview about the essay afterwards. So that's definitely something to think about. You need experience, at least 6 months experience of working in healthcare, ideally more. You need to have the support of the employing practice. You will need to be working in practice for a minimum of 30 hours a week, and you will need an enhanced DBS check. Even if you've had it within the last 6 months, it needs to be within 3 months. So the SNA programme, it's a 2-year programme, and they have to do 2,300 programme hours, which are divided into half theory and half practice learning. To meet the requirements of the training programme, they have to work in a range of settings and situations to get as much experience as possible from birth to death in the different age groups. They have to complete 450 practice placement hours, which will be in another place away from their primary place of employment. Just as a summary, just to say that the trainees released for 1 to 2 days a week in university, 20% of the programme, and they must have protected learning time in the workplace as well. So this slide's just a bit of a summary from what we were saying before, but I just wanted to mention placements because that's always a worry for primary care, for practices. You don't have to arrange those placements yourself. These placements will be arranged for you or for your student, trying to take in what they would like to do into consideration, and that is done for you for UE and for Western, but BPP will make their own arrangements for that.
And just to add that as a placement yourselves, as a place of work, you are expected to offer a reciprocal placement to other students coming in. But again, we can discuss that further, but that's sort of some of the understanding of the course. So just going on to a comparison of the local courses. So generally within BNSSG we use UE and the University of England, West of England, University Centre Western and BPP. The Open University do courses as well, but generally there isn't as much support, but we have got nurses that have done that, so you can contact us with more information about that. So all of them are generally, as Helen has said, entry requirements are the same. It's Western that have to have an exemption with level 3. There's links that we'll send out with this presentation for the course details, and you just note from this table the days that are released have changed. So with UE it was previously 1 day a week from September 24, so the next cohort, which starts on the 14th of October, it will be 2 days a week out at college. We're told that this just means that everything can be completed in the 2 years, whereas previously it often went on due to the field and the exam boards and things as well. University Centre Western remains at 1 day, and BPP are 3 days, but again that varies depending on the placements. UE and Western both do 2 cohorts a year, so May and October, March and October, and BPP have about 6, so there's a bit of choice there. So apprenticeships are fully funded for non-levy fee paying organisations. So we in effect borrow money from MBT or Serona or the BRI to pay for the apprenticeship levy. So as legacy nurses we can oversee that for you and send out application forms as well. the nurse associates will also get some money from NHS England. This is £4,000 a year, so £8,000 in total, and that can be used in any way to backfill or just anything associated with the nurse associate role. So that will be given as soon as the nurse starts at university. It can take up to 3 months afterwards, after they've started, just to come into effect. So just to be aware of that.
So if you have a prospective HCA that wants to do this training and they don't already have their GCSE English Maths or Functional Level 2 certificate, there are providers that can help them, and so for Level 3, which we'll show you on the next slide. So we've just put some links below which can help with further study.
So similarly, if your learner doesn't have a level 3 qualification and they're applying to UE, then they will need to have that. And so UE offer and Western offer also an apprenticeship in health and social care. So this is a level 3 certificate. And again, we've got details on the next slide about that. So this slide just gives details of providers that offer the level 3 apprenticeship. So you can see on there that it's Bristol, North Somerset, and Bristol again, that do those apprenticeships. South Gloucester don't unfortunately offer that.
So if you have an interested HCA, or if you're interested as a practice, you can write to legacy.nurses@avonlmc.co.uk, and we can help you to make sure that your nurse has the relevant qualifications and can help you with any more information about the course, and we can help you with the application and interview process as well. Just as a side note, any practice that wants to have a student has to make sure that they have a placement audit in place, and we can sort that out and help you with that as well.
So again, this slide just summarises what we've previously said. So the hosting practice needs to have practice supervisor assessors, so that's state training. There are free courses available at UE, and I think there's someone in Learning for Health as well. The practice need to have an apprenticeship service account set up. If you've had previous apprentices, that will already have that. But again, we've got a link there just to the government website. As Helen said previously, you need an enhanced adult and child DBS check, and again we can prompt with that later on. And again, the protected learning time, and just linking to the Nursing and Midwifery Council standards. So this table just summarises the difference between nursing associates and registered nurses. So you'll see that generally they can do most things. The only thing on there is non-medical prescribing. Generally the difference between the roles, the registered nursing associate is delegated to. They can administer medications and various things, but the registered nurse will lead and manage and delegate to the registered nurse associate. The only problem that we have still is that registered nurse associates can't actually give the immunisations using a PGD, so they have to do it all through PSDs. This is a long process going through a legal hoops, so which some practices are using PSDs to give children immunisations as well, so that's just a consideration. So just going on to talk about the Registered Nurse Degree Apprenticeship. So this is a 2-year programme designed specifically for registered nurse associates and assistant practitioners. So they enter the RNDA pathway at year 3. So they'll obviously have had the qualifications already to go on to and do this part of the degree. So it's funded in the same way as the SNA course, so levy transfer funding. So again, we can sort that out on behalf of the practice, but the main difference is that there isn't any reimbursement from NHS England. So the £8,000 that the SNAs are given, unfortunately that stopped in March 2023. So, but thankfully we can use the R's funding to be able to, assist with backfilling and all that sort of thing, but it just takes a bit more, sort of jiggling around. So that's the difference. The same providers offer the RNDA apprenticeship. UE run cohorts in November and then April and May time. University Centre Western haven't been offering it up until this point, but they're due to start a new course in January, February 2025. So we'll have more information about that. We don't know what that course looks like yet, but you know, again, if anybody's interested, feel free to contact us, and then we can, you know, we'll let you know as soon as we get information. BPP, again, multiple cohorts throughout the year, and we have had several nurses doing that. As you know, as from BSG, primary care and secondary care. So that's come to the end of the presentation. If you've got any queries at all, please feel free to drop us a line on legacy.nurses@avonlmc.co.uk. Just whether you're interested, whether you're a prospective student or a practice, really happy to have a conversation about any of that. Thank you for listening.
Bye.